I'm not sure till where I had presented.
Future part complete.
Oh,
This is the thing. Yes, that's
okay. Ugly duckling stage. So this is what, yeah, this is what usually happens by 9 to 11 years of age, and it is a self-correcting anomaly. That is like it gets corrected on its own. This is mainly because of these large canine teeth, that is the corner teeth, hitting onto the roots of the already erupted teeth, causing a space to happen in between, and these this will go off once these teeth erupts in position. So there is nothing to worry about or apprehended about. This gets corrected on its own and it doesn't require any treatment. So, coming to pediatric dental surgery, there are various conditions which require surgical corrections. One is cleft lip and palate. That is, you have the cleft of the lip as well as the palate. That is the inside of the roof of the mouth. So, the correction starts usually by 2 to 3 months. That is the surgical part, and it is usually corrected in stages. But otherwise, the other treatment or the management starts soon after birth of the child, because to enable the child to suckle mouth, we have to give them appliances and other to facilitate suckling. We need to provide help. So that starts soon after the birth, but the surgical part usually starts by 2 to 3 years of months. And nowadays, the reconstruction and the repair of these cleft is so great. The results are so amazing that it leaves behind minimal scar. If you see this picture, you see that there's absolutely, there'll be scar, but it is very minimal, that it is actually negligible. So when corrected early, the defect does not affect the growth of the jaw bones and also the child's speech. That is very important. You should get it corrected as early as possible so that the child will have a proper speech. Now these are very rare conditions. These are like, there are two types. We refer them to as mucosal. This is actually called a ranula. That is the saliva. The saliva is produced by salivary glands. There are glands within the mouth which produces the saliva. So the passage of the saliva gets blocked, and the saliva tends to pool, and it becomes a bubble-like appearance. So in a newborn, when it usually happens, this is the picture. The tongue is often raised, because of which there will be difficulty in feeding, and this can be surgically corrected. This is a surgically corrected case. So you can either get them surgically corrected, or there is cauterization. That is, you use instruments to slightly burn it off. That is like I'm using the common terms. It is not actually burning, but cauterizing. We call it cauterizing. Remove it using heat. The second type of ranula, this is usually seen on the undersurface of the tongue, below the tongue, which causes the tongue to be raised. And this is another type of mucosal. The same thing happens on the lip. Lower lip is the most common place where it is seen. This is a corrected picture. This is again due to the child accidentally biting on the lips, and there is trauma to the passage of the saliva, and that duct gets blocked, and there is saliva pooling, and there is this bubble-like appearance on the lip. That again can be corrected surgically. So these are the surgical part of pediatric dentistry. Next one is the tongue tie, frenectomy. That is, there is like, normally there is band of tissue that attaches the tip of the tongue to the floor, the not the tip of the tongue, the undersurface of the tongue to the floor of the mouth, and the tongue can move in all the directions. But once this attachment is to the tip, it will restrict the tongue movements. So this will affect the child's speech, and because the speech is affected, the overall psychological development also. The child will be very conscious because the speech is not proper. So this is best to be corrected even before the child begins to speak. And if it is in the upper arch, like if you pull your upper lip, you'll see another muscular band which connects the upper lip to the gums, upper gums. So that if it happens in the upper arch, if it is not properly attached, that is the attachment is too low, that is it is in between the two front teeth, then this can be corrected first by surgery, and then the space can be closed orthodontically by with using wires and the brackets. The last part, there are more, but I'm just telling you the most common conditions. This is what is called the mesiodontal. That is a supernumerary teeth. That is an extra tooth which is found. Usually there are 32 teeth, but there will be extra teeth which are present in the normal set, in addition to the normal set. And the most common extra tooth is a mesodont. That is the most common one to be present is right in between the front teeth. And this tooth can cause these teeth to be positioned in a certain unfavorable position. So these extra teeth should be removed as soon as possible, and the front teeth should be orthodontically corrected to bring it back to normal alignment. All these are not very time-consuming procedures. These can be actually done and corrected in like 1 to 2 months. The last but the most important is the conditions which are present in special children. Special children are those with physical, mental, and emotional handicaps, and we require special care and treatment for these kids. So these kids and also these special kids and also very young children who are unable to comprehend and cooperate for a treatment, like those kids who are less than 2 years of age, but they have a deep decay, they have a pain, and they need treatment, then it becomes necessary for the treatment to be carried out under general anesthesia. That is, in a hospital setup, we give them general anesthesia. The dentist does only the dental part. The general anesthesia is given by the anesthetist after a full pre-anesthetic checkup, and after certifying that the child is fit for anesthesia. And it is actually a totally safe procedure, and it is a very convenient and comfortable procedure for the child also, because the child sleeps throughout the procedure, and all the procedure if you see this condition, for example, there are multiple teeth which will require root canal treatment. There are multiple teeth which will require removal. There are teeth which will require filling. So while treatment is done under general anesthesia, the treatment usually takes place in over like 1 to 2 hours, and all the treatment, the comprehensive treatment is given to the child in that 1 to 2 hours, and the child's mouth is rehabilitated. There is a full mouth rehabilitation done so that he or she will not require another dental procedure in the near future. Like until these teeth sheds, there won't be another dental treatment required. So after like 12 to 13 years, once the child is capable of cooperating for the treatment, it can be done on the dental chair without any anesthesia. So with this, I think I've covered briefly everything that is related to pediatric oral health and how an early intervention will help us maintain healthy oral environment with simple treatments. So it is actually the early intervention, that is, as soon as you notice a decay, get it filled, or you should try to prevent the tooth decay from occurring. So early intervention is the key. So I thank you for your patient listening, and this is my WhatsApp number and email ID. If at all you require any assistance or any help, I'm ready to help. Please feel free to contact me. And if there are any queries, I'm ready to answer them too.
Yes, ma'am. Thank you so much, ma'am. So you have explained a lot about this, ma'am. I too came with a lot of questions for my kids. My doubt has been cleared in your class itself, ma'am. Thank you for that, ma'am. So this is questionnaire session. So anyone want to ask questions to ma'am, you can raise your questions and clear your doubts with ma'am. Yes.
Okay, I want to ask one question, ma'am.
Yeah.
Yes, ma'am. My niece, she is 7, and then she was undergoing pulpectomy, and then she was fine at the clinic. But then after she got back, maybe we don't know, maybe because of the dose that has been used or because of which one, we really don't know. But it seems she had a nightmare. So what shall we do in order to cope up with it?
Better than I can do, he or she may be able to do a root canal treatment. Similarly, there is somebody called a prosthodontist who replaces a missing tooth. So each specialty, the specialists are they are trained to do that treatment very well during their post graduation days. So it is always better to take a child to a pediatric dentist. There are many general dentists also doing pediatric procedures. The pediatric dentists are trained in child psychology too. So the approach is different. So rather than getting the child scared or making him or her afraid of the treatment, showing them, taking time to explain what is being done to them and then doing it makes a lot of difference. They tend to cooperate for the treatment. So actually they cry because of their fear. They don't know what is going to happen there. It is because of the fear of the unknown that they are crying. So once they get to know, once you demonstrate what is going to be done to them before doing it in their mouth, like showing it in their hands or explaining it to them, that actually creates a better environment for treatment. It is because the child got scared that he or she has got a nightmare. So one thing is, before taking to the dentist, you should actually prepare the child. At home, you have to prepare the child. You can tell they'll just wash your tooth, take off the germs, and then fill it with the material like chocolate colored material. We say Kinder Joy material and all, so that they look forward to what is going to happen. They are prepared for the appointment. Then they come, and once they come, we can actually tell them what is going to be done before doing it. Parents scare the kids, saying if you don't eat properly or if you pouch your food in your mouth, your teeth will get spoiled. You will have to go to a dentist. You will get injection there or get it removed. So that negative feeling or the negative thought is already there in the child's mind. If I go there, I'll get injection, I'll get my tooth removed. So they come with that fear. So prepare the child. Rest the pediatric dentist can do it.
Okay.
Yes, thank you.
Yes, good evening, doctor. This is Sarita. Actually, I have a doubt, doctor. I used to floss my teeth, and my child, she is just 12 years old, and she has also started flossing her teeth twice. So, is it proper for a child to floss the teeth?
Yeah, 12 years, she'll be having almost all her permanent teeth erupted by now. So
Yes.
flossing is actually okay. Flossing is the best way to get the food out of the interproximal areas, that is the space between the teeth, provided it is done the right way. Sure, it is being done the right way. Like get a demonstration done from your dentist, or take 15 to 18 centimeters of floss, tie it between your index fingers. And how you floss is most important. For upper teeth, it is always between the teeth and pull it down. To go further up, you will enjoy your gums. So if it is properly done, it is very good. If it is not, if it is the incorrect way, it can lead to gum problem. You can cause gum problems because of incorrect flossing technique.
Oh, that will lead to an increase in the gap between the teeth, ma'am?
That will it will eventually cause a gap in between the teeth, because once you start injuring the gums gets inflamed, and because of the gum inflammation, there will be food lodgement in between the teeth, because of the gum inflammation, and that will eventually lead to gum problems and spacing in between the teeth. Not maybe for your daughter because she's too young, but eventually that will happen if it is not done properly.
Okay, thank you.
I think Ananti ma'am got disconnected.
Okay, ma'am. My sister, when she was studying in the school, means adult time, she was small. One of the friend pulled her out, and she fell down, and her teeth, one of the front teeth has broken little bit, and we thought of it will be okay. Then afterwards, now she's grown up, and now she's having pain. Sometimes she's having swelling and all, and we had done root canal. After root canal, also she got pain again. So the doctor told her to fixing. That means there her a portion, the teeth portion had means that, and the doctor told her to fixing new teeth instead of that teeth. So is it good for?
How old is she?
Now she's 20 years old, ma'am.
To preserve the tooth which is root canal treated, it is always best, or it is mandatory that you put a cap for the tooth after the root canal treatment. But if you what you said is like after the root canal treatment also she had pain, then that has to be looked into, because usually root canal treated tooth, if it is done properly, won't have any further pain episodes. So first that has to be looked into, whether the root canal treatment has been done properly, whether the filling is proper, what has caused that pain after the root canal treatment, and that has to be solved. And then obviously the cap has to be put.
Yes, ma'am. Ma'am, I have a doubt that my son is 4 years old, ma'am. And right now he had tooth pain, ma'am. And I consulted doctor, and she filled that area. But after some days, again he had pain. So the doctor suggests that now he is not well. So after that, she said that come to the hospital, and she said that maybe we can do the root canal and all, ma'am. So is it necessary, ma'am, for doing the root canal for the 4 years old child?
Yes, this is exactly what I was talking about. See, root canal treatment is nothing but the filling. We are taking away the infection from the root portion of the tooth also and filling it up. Just like we fill the tooth, just like now baby has got a filling, the root of the tooth will also be filled after taking away the infection or the pus which is inside. Now what has happened is, what exactly has happened to the baby is there was a tooth decay which was deep.
Maybe
That deep decay in which actually a root canal treatment should have been done. That is, there was already pus in the pulp area, so that pus was not taken away. Before that, it was just simply filled. That is like sealing the tooth.
Yes,
So
ma'am,
there is
correct.
pus inside, and it has been sealed from the top. So the channel for the pus to go out has also been blocked,
Yes, ma'am.
and that has caused the pain.
Pain.
So
Yeah.
so that has to be removed. That is, the pulp chamber where the infection is residing right now, that has to be cleaned and that has to be filled. That is root canal treatment. There is nothing to worry about. And age is
Ma'am,
not a bar for canal treatment.
Okay, but
See,
ma'am, yeah, but it's take pain, ma'am, for him. Maybe
No,
I don't.
no. There are two ways of doing root canal treatment. One is if the root canal treatment is done on a tooth where there is already a boil or a swelling, that means the tooth is already dead. It is non-vital.
Oh, okay.
So that tooth doesn't have any pain sensation. So for that tooth, there is no need for anesthesia. We don't give an injection to numb the tooth before root canal treatment. But for teeth which has pain, we usually give an anesthesia, that is an injection to numb the tooth. And this injection is not like the big like the big needles which you use for your vaccination. These are very small insulin needles. The child hardly will know that prick being given. So there is absolutely nothing to worry about pain part, because if it is a vital tooth, that is, if it is a live tooth, then the tooth will be numbed before the procedure.
Okay, ma'am. And ma'am, which type of toothbrush you have to suggest for the babies, ma'am, for the child
Toothbrush.
toothbrush. Yeah. Yes, ma'am.
Soft bristled baby toothbrushes are available.
Soft.
That
Yeah.
and yeah, Colgate or all these like Colgate kids toothbrush and paste are commonly available in all the supermarkets also.
The soft type brushes, right, ma'am?
Yeah.
Okay, ma'am. Thank you, ma'am.
Yes, ma'am. So shall I ask one more thing, ma'am? I have to clear whether I have understood correctly or not. For that, I'm asking, ma'am. Okay, ma'am, you have said no. The teeth which has been premature teeth will be there, and after that, if the teeth was like spacing was there, means something extra teeth that like that only, no, ma'am. Extra will be growing so that it will get proper. Am I correct, ma'am?
I didn't get you. I didn't. I'm sorry, I
Okay,
didn't get you.
let me say the first problem first. For my son, no, ma'am, before the milk teeth has been, before it fell down, the teeth has grown already inside. Okay, but we didn't do anything. After that, the real teeth has fallen down, and then that teeth came front. No, nothing problem was there, but it became flattened. It was like very big, and space was there between the front teeth, two teeth. No space was there. So whether we have to correct that or no.
No, ma'am. No, ma'am.
We can hear you, ma'am.
I think Meena ma'am
Ma'am
has
has done that.
Okay, yeah, yes, ma'am. So her video is freezed.
Yes, ma'am. So
Yes, ma'am. It was really a nice session. I hope it's when we listen to all her points, I realize it's useful for everyone. Let's say like for the mothers it's very useful, and even if the viewers are already grown up and they don't have kid anymore, it will be useful for their grandchildren also. For those who are not yet married, those who are not having child, it will be very helpful for them also. So it has been very beneficial for everyone, right?
Yes,
yes, ma'am. Yes, ma'am. Yes, ma'am.
Okay,
Because
let's go.
we are knowing more about the small, which newborn baby itself having the protection of the teeth, no? So
Yes,
we are getting more knowledge. That was the really, because nobody knows. I think it's not aware of this such thing. The newborn baby is also having. Yes, ma'am.
Okay, ma'am is
That
reconnecting.
knowledge, I think that knowledge will be having some fear on our kids. So what will happen, whether it can be done, whether it can't be done. So that fear will get rid of. That is the main.
Yes, ma'am. It
Yes,
has
ma'am.
been
Yes,
so
ma'am.
beneficial.
I'm so
yes,
sorry. I lost my connection.
it's fine, ma'am. It's okay, ma'am. So Ananti, ma'am, you can repeat your question.
Yes, ma'am. So that's the thing, ma'am. So the teeth has fallen out. So that the
Okay.
teeth before fallen, it has grown. No, that became front, and it was normal. It was not like this. Nothing was there, but it became more flattened, and space was there between the teeth.
Okay.
Then he says whether it was looking awkward for me, like that he was asking me. I don't know whether to say it is okay or normal or we can do something. He's
How
only
old is he now?
7 years, ma'am.
7 years. That is okay. Like it is right now in proper. It is right now in proper position, right? It is not behind.
No,
Like it is in the same.
no, not behind.
Alright.
It is proper position, but space gap was there.
The spacing is okay. It will go off once the canine, the corner teeth erupts. It will go off. Even for the lower teeth, to an extent, that space will get closed by around 11 years of age. When the other teeth erupts, because of the pressure, these spaces will close.
Okay. Why it became flattened, ma'am? Before it was only small, now became big and flat.
It is not actually flattened. We feel it is flattened, or it is like too big, or it is yellowish in color. All this because we are comparing it with the small milk teeth which was initially present. Like even for us, if we ask our parents, they would have also felt the same thing about our teeth. But once all the milk teeth goes and permanent teeth has erupted, it will all look the same. We wouldn't feel anything awkward about it. But once it is like a few permanent teeth along with the milk teeth, when it is present in his mouth, we start comparing with the milk teeth, and we feel that this is flattened, this is too big, this is very yellow. It naturally happens, but it is actually the normal color, the normal size, and it is not flattened.
So, any more doubts?
Yes, I'm having, ma'am, I'm having. So, for my daughter also, no, ma'am, you have said, no, after we were feeding, we have to clean it with a cloth or like that. I think I have missed that part. Now she is 4 years. She will be having in front teeth alone, like what to say, something will be sedimented, on sedimented way it will be, ma'am. And sides of the tooth will be like the shapes, no, it will be reduced. I think it will be powdering and then it will fall off, I think. Whether it can be that is milk teeth only. So you have said about paste and all, fluoride paste. So anything additional thing before I can do for that, ma'am?
Yeah, that GC tooth mousse which I mentioned about, that is the best thing you can use.
Okay. The teeth, no, side wall of the teeth
That is like it wouldn't. Yeah, that is how it starts. So if you use the GC tooth mousse, this decay, it wouldn't go off, or it wouldn't, like, you shouldn't expect once you start using that cream the tooth to go back to how it was a normal healthy tooth. Why we use that cream is because we don't want it to go become worse any further. So it will arrest it at what condition you are starting to use the cream. It will maintain the tooth in that in that condition, so that you don't have the child won't have pain, or the decay won't go deeper. It won't cause any infection as such. The fluoride application has to be done by the dentist. The cream, you can apply it every night. The baby is not being breastfed now. At night time, you can apply and put him or her off to sleep.
Okay, ma'am. Thank you so much, ma'am.
Thank you.
Yes. So anyone want to ask question?
Every doubt has been cleared by ma'am. You have explained everything in a very beneficial way. So thank you so much, ma'am.
Thank you so much.
Thank you.
Yes, Yomi, ma'am.
Yes, ma'am. Minu, ma'am, shall we call Ananti, ma'am, for the word of thanks?
Yes, ma'am. Yes, ma'am. Yes, ma'am. Let's wind up. Before winding up, we have to thank to everyone. So let us welcome Anandi, ma'am. Welcome, Anandi, ma'am, for the word of thanks.
Thank you, ma'am. So, good evening, my dear ladies and gentlemen. It gives me a very immense pleasure to deliver this vote of thanks for this event to our dignitaries who are available here. So, I would like to extend my thank and express my gratitude to our resource person, Dr. Meenu Prasanna, ma'am, who is a pediatric dental specialist. Your presence was it's a very good contribution to us today, ma'am, to make this webinar as a very successful one. And I extend my gratitude to Baba sir, our master trainer, and our Rising Spin Circle coordinators, evaluators, and all the NCDC faculties and members of the NCDC family. Last but not the least, our beloved participants and volunteers who listened patiently and raised questions and also clarified their doubts, which makes this webinar a very great success. So I believe you all benefited with this wonderful webinar, and ma'am has said if you all having doubts, you can contact her. She's there to help. So you also can contact them, and if you want a number also, you can contact our Rising Queen Circle. So we will be getting that number to you. Okay. Thank you so much. Thank you, ma'am, once again, and thank you a lot, ma'am.
Thank you, Ananti, ma'am.
Thank you, ma'am.
Thank you, Anandi, ma'am. And also special thanks to Meenu Prasannan, ma'am, Dr. Meenu, ma'am. Thank you so much, ma'am, for coming here, giving your valuable points, which we all want to know about our child's dental problems. So that's very good information and very good valuable points. Thank you, ma'am. Thank you so much. Thank you all.
Yes, ma'am. I think Shireen ma'am got disconnected. So I'm sure she must be also very thankful and she must be also very grateful. So on like for her sake also, once again, I'm thanking our Dr. Minu Prasannan ma'am. Thank you so much, ma'am. So we are looking forward to see you another time also, ma'am.
Sure.
Okay, so
Forward to it.
ma'am. So thank you all and God bless you all. Have a great evening.
Thank you.
Thank you all.